Okay, so we'll get started. Thanks again for joining. This is Nava Labs' June demo day, how to design impact evaluation for government AI tools. And if you're not familiar with Nava Labs, we are a part of Nava, and we use philanthropic funding to prototype safety net innovations that government agencies need but can't fund directly. We build and test new approaches to delivering public services, evaluate what works, which is what we'll be talking about today, and we advocate for scaling proven solutions. And a lot of our work lately has been in the responsible application of generative AI in safety net programs. So today we're going to talk about a practical, methods-oriented guide to designing real-world impact evaluations for AI systems specifically in public benefit programs, drawing from three of our generative AI pilots. So let's dive in. Today, I will be joined by my great colleagues, Laurel and Michael. Laurel is our data and evaluation lead. Michael is our partnerships and evaluation lead. And I am a senior designer researcher, and we all work with different teams working on generative AI tools in the public benefit space. So to introduce the topic, government teams are under pressure. They are moving quickly to identify different use cases and pilot AI tools. And they need to know not only that they're working, that they're responding, that they're doing the task we are trying to get them to do, but that they're actually providing accurate results, that they're driving real outcomes for programs, for staff, and for the public we are trying to connect to services. So this means questions like, is it improving staff efficiency? Is it reducing administrative burden? And are we ultimately improving service delivery outcomes? So if you Google AI evaluation, you'll find a lot about how to evaluate the accuracy of AI tools. But this conversation has a little bit of that, but is mostly around this question of not just, is it working, but is it worth it? And so the methods and the toolkit we're developing, we try to be conscious to make it relevant for teams of any size, all with the goal of testing what works for whom and under what conditions as a very high level definition of impact evaluation. The methods are accessible to small teams and projects working without huge sample sizes or a lot of resources. And we'll talk through today how to design an evaluation plan that works with the constraints of your particular context. So we're framing the conversation today in our suite of caseworker empowerment tools. And all of our evaluation examples are kind of grounded in our experience developing and evaluating these tools. And this program builds AI-powered tools to support caseworkers who help families navigate and enroll in different public benefits. And we've worked with state agencies, we've worked with community-based navigation organizations, and have started to build this toolkit about how to not only build these tools, but to evaluate them as well. All of these tools are open source, so if you're into the code side of things, you can go find the GitHub repos for them. And they're all built with the goal of giving caseworkers time back to do the human relationship part of their work and less of the administrative burden. And so to talk a little bit more about the examples we'll be using for our conversation today, the first one is the Assistive Chatbot. And that is a tool, kind of the typical chatbot interaction you picture, where a caseworker can ask questions about the different programs they're supporting, like SNAP, Medicaid, and others, and get responses back from trusted information sources. And then the sort of unique emphasis of our implementation here is the ability to show direct quote citations that can't be changed by the LLM tool. Also, before we get too far in, we'll be collecting questions throughout the whole conversation. So if you don't see that in your Zoom bar, it should be under More and then Q&A. And myself or other members of my team might be answering questions as we go, and then we'll have time at the end for questions too. Okay, so our first tool that we're going to reference is the Assistive Chatbot. And second one is the Referral Generator, which has the goal of collecting resources from a lot of different sources, some of them external to an organization like a 211 or a Find Help, if you're familiar with those, but also internal resources, say a Goodwill job training program that they run, and puts it all in one tool for caseworkers to easily navigate between and generate action plans for their clients to actually get the support that they're being connected to. And lastly, we have our form filling assistant, and this uses agentic AI to take information from a case management system or other system of record and fill out application forms automatically, but keeping the caseworker in the loop to actually review and confirm that information before it gets submitted. So again, these are some of the tools we're going to be referencing today for some of our evaluation approaches and examples, and there are more on caseworker.navapbc.com. But for any of our projects, AI or not, we always try to think about impact evaluation at the start. And there are many different kind of lenses to consider. Some of them at a high level are identifying the outcomes of interest. What is a meaningful outcome to focus on for staff, for the public, for the program as a whole? Decide on a data collection strategy. So what's realistic for you to collect to see what's moving the outcomes. Develop a timeline, build those data collection capacities, actually collect and check your data, analyze it, and then share the results. And we'll dive into some of these steps as we go, but just for a high-level framework about how to approach impact evaluation. And to get more flavor to that process, especially with the AI focus, we have 5 key questions that we're going to anchor on today. The first of which is, how do we define and measure impact? The second is, how do we know experiences are improving? The third is, what if we have a small pilot population? The fourth is assessing accuracy of AI outputs. And the fifth one is, how do we pull all of that together to make decisions based on what we're learning? And so for our first question, I'm going to pass it to Laurel.
Hello, my name is Laurel Ackhouse. So I'm the data and evaluation lead at Nava Labs, and I'm here to talk about the first and second questions, starting with this core question of how do we define and measure impact? So just to return to our preliminary answer from earlier in the presentation, at a very high level, we can think about impact as what works for whom and under what conditions. But of course, that gets into a lot of really specific details, and there's a lot of work to be done to understand what it means for something to work, and how to understand what the conditions actually are. So it's helpful to frame how we think about impact and what it means, right? And the core thing that we're thinking about is what changes can we credibly claim that our program caused? Not what changes happened around the same time, not what changes happened during the course of the program, but if our program hadn't existed at all, then what would the world look like and how would it be different? So it's helpful to build that out a little bit. Imagine that you're launching an AI intervention to help caseworkers, and you have access to a parallel universe. In that parallel universe, everything is exactly the same. You have the same time frame, all of the same outside events, the same exact clients walk through the door, except those caseworkers won't be getting the AI intervention the way they do in our universe. The difference between the caseworkers who got access to the AI tool in our universe versus the same caseworkers who didn't get access in the parallel universe, that's really the causal impact that we're aiming to understand. But of course, we don't actually have access to a parallel universe in which we can unpack in which we can measure the counterfactual outcomes. But this thought experiment does give us a chance to think about what would have happened without our AI intervention, which is called the counterfactual. On a more pragmatic level, not just in AI evaluation, but arguably in all evaluation efforts, we want to clearly define what impact means, because that will directly inform what we measure and how we measure it. One way to sort of structure your thinking about this is to use a logic model or a theory of change. So it's a sequence of if-then statements that help explain how your intervention would work. So in this case, right, we're thinking about if we launch an AI chatbot, then caseworkers will have access to some decision support. And if caseworkers have access to this decision report, then caseworker well-being will improve. Right? That's our theory of change. That's our theory of the mechanism from which getting an AI chatbot leads to some kind of outcome. In this case, benefits for caseworkers. Okay. When you're measuring impact, there are a couple of different ways to think about it. So the first one is to focus on validated measures. So when we tried to understand caseworker well-being, we used the administrative burden scale. This is three separate questions measured on a 5-point scale, with 5 being more burdensome. There's a learning cost. How difficult was the process of finding information about the program? There's a compliance cost. How difficult was the process of filling out the paperwork, providing proofs, all that kind of stuff. And a psychological cost. How frustrated did you feel during those experiences? This is a measure that was developed by the Better Government Lab, one of our academic partners, and it's a great measure. It's validated. They've done a lot of work to make sure that it's measuring what they think it's going to measure. And they also use it in papers, and other people use the administrative burden scale as well. So that means that we have the ability to compare the outcomes on the administrative burden scale with outcomes in other projects and other programs. It enables comparisons with other evals. It saves time. It can be really helpful. But sometimes there's no validated measure that actually gets at what you're interested in. And in that case, you really want to think about how to design your own. It means you can get a tailored measure, but it's potentially harder to compare with other studies. You're really looking at apples and oranges if you're looking at really different measures. And it can also require more time and more scrutiny. So if you're making your own measures, make sure to test them vigorously before you actually deploy them. So far, we've defined impact. We've touched a little bit on measurement strategy. Obviously, there's a lot more to talk about with either of those things. But this brings us to our next question. Where can we find data to help us inform impact? And here's a Venn diagram showing what some of the potential data sources come from. So we can have quantitative data, surveys. They can be cross-sectional. It happened once. They can be longitudinal. You do them more than once. You can have product log data. That's often familiar to people working in civic tech and other tech oriented organizations. You have administrative records. Those can be incredibly helpful. You have time studies, right? There's a lot of different ways that you can measure that, that you can create quantitative data. You can also have qualitative data, right? You can have interviews, journals, direct observations, participant reporting, all of that kind of stuff. In our AI projects, we have typically tried to incorporate both data types, which can be really helpful. This is often called mixed method. Whereas more specifically, we've been using explanatory sequential design. We collect quantitative data to identify variations and patterns of interest, and then we leverage qualitative data to help us better contextualize and interpret the data so that they're ecologically valid and grounded in real world experience, so that we understand sort of the mechanisms behind what we're observing, the patterns we're observing in the quantitative data. All right. So again, so now I'm ready to move on to the second question. How do we know experiences are improving, and are these changes happening because of our interventions? So again, we're defining impact evaluation as what works for whom and under what conditions. But how do we know that our intervention, we talked about measuring that, how do we know that our intervention actually caused a change? So let's suppose that we implement an AI chatbot to help reduce caseworker burden. We run this pilot for 6 months. We look at the data on tool usage and burden score. We see that as usage goes up, burden goes down. Right? We've got this great downward sloping slope. And at this point, it's natural for us to get excited and start thinking about scaling. Great, these two things have happened at the same time. Seems probable that that there's some kind of causal relationship. But it's important to pause here and put on your skeptical hat and think, what if there's some other explanation for this pattern? Maybe there's something else that's causing both patterns simultaneously, right? So as perhaps all of us in this room have heard, this is just a reminder that correlation and causation aren't the same thing. So the pattern we see on the graph on the left, where people who have higher chatbot usage also have decreased burden, it's not guaranteed to be causally related. Maybe there's something else going on. Maybe people adopt chatbot usage when they have more cognitive capacity, and it makes it easier. It's easier for them to pick up something new. We can so we could think about that as reverse causality. We could also have concurrent factors, right? Maybe some people are being required to use the chatbot or pushed more to use the chatbot. And there's something, an organizational factor that means that those people also are experiencing less administrative burden. There's all kinds of things that could be happening, especially when there's change over time, right? Anytime you're looking at some kind of time trend, there's always a lot of other stuff happening because the world is constantly changing. And so it's particularly important to be thinking about what else might be causing both of those patterns separately rather than one of them causing the other. So then how do we get closer to understanding causal impact? So one place to start, right? We measure impact metrics at 2 time points and estimate how much change happened between those 2 milestones. This is from our referral generator pilot, where caseworkers use an AI tool to find suitable resources so clients could access housing, food, health, jobs, all those critical determinants of well-being. We use the administrative burden scale to measure caseworker burden both before and after we launched the AI tool. And then we compared how much their burden costs changed, and we applied statistical testing to determine if those changes are meaningful. So you know that before they didn't have access to the tool, after they did have access to the tool. But again, correlation and causation aren't the same kind of thing, right? This can be very pragmatic and straightforward. It's very, you can use the entire sample size. You can evaluate changes within an individual person. So if there are changes that are happening, maybe the organization hired a bunch more people. Who knows? There might be something else happening that could be causing these changes. So this problem is fixable. And we'll talk about that on the next slide. The cleanest way to fix this problem is randomization. With randomization, you randomly assign people to groups. And so then you know for sure that those differences between the 2 randomly assigned groups, the people who got the chatbot intervention, people who didn't get the chatbot intervention, they can't be based on some other meaningful difference because you are the person who decided who went in what group. And you decided that based on a totally random number generator that doesn't have anything to do with anything else. It's not because the people who opt into the pilot are more or less experienced, because they have more or less work, anything like that. Instead, they got access to the pilot by random chance. That means the control group is the closest we can get to the counterfactual. It's the universe where everything else is the same, just without the intervention. Here, you can see the measures for the treatment group, which used the AI tool, and the control group, which didn't. Pre-intervention is on the left. You can see there's a small difference. And administrative burden does go down for both groups over time, but it goes down a lot more for the treatment group. If we didn't have a control group, we might not be able to tell if the treatment group's reduced administrative burden was caused by the intervention, or if there was just something else that happened at the same time. Instead, we can look with the information that we have, we can look at both the direction of the change, both groups went down, and the magnitude, right? The treatment group had lower administrative burden than the control group, and the magnitude is 1.1 points on the 5-point scale. Planning and interpreting randomization does have some tricky elements to it. You typically need a larger sample size than you do with just a pre and post assessment or with primarily qualitative data. It also needs to be planned in advance before you roll out the intervention. At Nava Labs, we're doing a lot of work to embed evaluation in projects from the beginning so that we can make sure that we can design the implementation and the intervention up front in order to get causal measurements. All right. So just to review, how we use study design to help identify cause and effect and build evidence. So the first thing to think about is measuring the concepts of interest before and after intervention. In that case, you always want to use unique participant identification to enable pre and post data linkage so you can look at the same person before and after. You want to assess with in-person change and then consider interim waves for monitoring. It can also be really helpful to assign participants to treatment or control groups. This can really strengthen your causal inference and rule out alternative explanations for the observed changes. Randomizing these group assignments requires a bunch of things to come together, right? Sample size, logistics, ethics, and most crucially, partner cooperation. And it's also really useful to use a mixed methods approach, even when you're focusing on quantitative data. Helps you add context to explain why changes occurred. It helps to strengthen the evidence base and the credibility of conclusions. But you might be thinking, what if we have a really, really small group, right? What if these quantitative approaches really aren't feasible? And for that, I'm going to pass you to Michael.
Great. Thank you so much, Laurel. Yeah, and really excited to share with you our insights and our lessons learned from this question number three. What happens when you have a pilot with lots of participants in the hundreds and the thousands? That's great because it gives you statistical power. You can identify cause and effect. But what happens if you have a small pilot with, say, just 20 participants? And I think our lesson learned, as I walk you through this section, is that even small samples can potentially generate meaningful evidence and insights to help guide your decision making. So, for context, I'm going to use our most recent pilot that's still ongoing called the Form Filling Assistant to tell you, sort of give you the 30-minute description of this particular pilot. The Form Filling Assistant uses agentic AI to essentially fill out benefit application forms automatically by pulling from existing client data from case management software. So the sort of thrust behind it is that it allows the caseworker to essentially shift from doing data entry to doing data review, right? Because the AI tool now handles the data entry. And our hypothesis coming in is that it'll help reduce administrative burden that comes with filling out tedious forms, reduce errors because sometimes I've easily confused the month and the date or phone number or little errors like that. Um, and I think our overarching goal is really to help smooth out the navigation experience, particularly if you think about a fragmented landscape of different programs and different rules and different forms and so forth. Um, in terms of timeline, we started this pilot almost a year ago. And so we're coming up on our 1 year anniversary, working closely with our partners at Riverside County, California. And because we're talking about small samples, so over the past year, we've gotten to work very closely with about 20 caseworkers at the Riverside County Children and Families Commission, and also recently just onboarded a few more caseworkers from the JFK Memorial Foundation, also out of Riverside County. If you're curious about what this tool does and what it looks like, there's a demo of this tool on the Caseworker Empowerment Toolkit website, which is just, I think, caseworker.navabbc.com. So coming into this pilot, working with our county government partners, we knew coming in, that I think we were told there'd be up to 20 participants, 20 caseworkers. And while the sample is smaller than what our previous pilots have recruited, we really saw this as an opportunity to go deep, right? Because with a smaller group, we were able to intentionally craft opportunities where we got to connect with every single caseworker and hear about their experience. This gave us super rich and nuanced and contextualized like understanding just about like how and what and why their form filling workflows are burdensome, right? And through these one-on-one conversations and interviews, we asked and heard about these caseworkers' preferences and needs, even their comfort with technology, what they think about AI, which is rapidly evolving every day. And most importantly for us as software people, as technologists, it gave us insight into what features might potentially be most valuable to the day-to-day work of these caseworkers. Um, and I think our lesson learned is, by having these conversations, we started to sort of collect and accumulate insights and ideas and pieces of information to help inform our design and build, to help us figure out if we're headed in the right direction, and also to help identify specific contextualized opportunities where improvements can be made. And so small scale is a different kind of opportunity. And for this particular pilot, it's really perfect. I know many of us here in the room are probably practitioners, and so I think it's worth sort of just, echoing that uh, in these small pilots, oftentimes I think the most valuable thing is a chance to form deep collaborative relationships with caseworkers, right? And one of our earliest decisions was to take essentially a team field trip to visit caseworkers at Riverside County. And once we got there, we were able to shadow caseworkers, sit in on client appointments with their consent, of course, and really hear about the stories, the ins and outs, the day-to-day experience of how caseworkers kind of conduct their work. Um, and I think the most important thing for us that we got out of it is that these observations that we collected helped us better understand just how complicated and how sometimes how challenging it is for frontline caseworkers who are helping families navigate benefit programs. Yeah. And to tell you a little bit more, to get into a little bit more details about the qualitative approaches that we used, just to sort of highlight three particular methods. You already heard about, I think I mentioned on the previous slide how we shadowed caseworkers, which gave us a good window into, what their pain points are, what the opportunities might be, and how our tool might fit into their workflow. But we also conducted a series of these semi-structured interviews with caseworkers throughout the pilot. So over the past year, we've been talking to them, a couple times a month just to check in. And we analyze these transcripts to really try to identify themes and sentiments and patterns. We're able to track how those themes evolve over time, right? And I think our core goal there is to really figure out like what's working, what might be getting in the way, or perhaps as we've learned recently, what are some of the broader social and organizational or contextual factors that have very little direct connection to our tool, but are having very real influences on how caseworkers are interacting with clients, how they're thinking about technology, and sort of what concerns and fears they might have when it comes to all the changes that's happening in this complicated world. And then the third piece is that we conducted a series of usability testing, particularly in the earlier phases, right, where we got built these prototypes and we got to observe caseworkers complete real tasks using the tool, which gave us insight and understanding into like where things went smoothly and maybe where things got stuck, what we could do to make design features a little bit easier and clearer to navigate. And so together, these three methods kind of gave us, a much richer understanding than just looking at metrics alone, and it gave us a window or ideas for how we can improve as the pilot went along. So on the usage side, we probably, like many of us in the room, we kept a close watch on real-time usage analytics, right? So trying to understand, among our 20 caseworkers, who's actually using the tool, how long do these sessions last? What benefit applications are being used on behalf of clients? And then also like how many applications are successfully submitted using the tool? And of course, because this is a pilot, we're keeping an even closer watch on when errors occur, right? Particularly when caseworkers are using the tool to navigate application forms that may be a little bit more complicated, right? So if you think about application forms that have complex skip patterns, right, where subsequent questions depend on what they said in a previous question, or application forms that have complex branching designs, right? So if you selected A, it filters you to this part of the form. Um, and so watching these errors also helped us better understand, how adoption is going, how caseworkers are interacting, or how they're responding when these errors emerge. And it just to say, as another dimension that's not on the slide here, we also conducted a time study to really try to understand, to try to measure, to try to quantify how much time caseworkers are spending on application-related activities. And actually, as we wrap up the pilot in a couple of weeks, we're planning to replicate that study and see what might have changed. Because I think ultimately a really important point to make here is that even with a small sample, if we can demonstrate that a task that used to take, say, 90 minutes now only takes 10 using the tool, I think that's potentially helpful and valuable signal, right? With implications for both time savings and I think more importantly, with potentially with caseworker well-being. So a quick story time here. A few months ago, we were looking at. I realized you see a quote on the screen here from one of our caseworkers that participated in the pilot. So a few months ago, we were looking at usage data, the product log, and we noticed that there was one particular session that ran unusually long. Right? I think it was pushing north of 45 minutes for something that typically would only take ten minutes. And so we were looking at the timestamp and sort of started worrying as a team. And our assumption was that maybe the tool was ran into a hiccup somewhere along the way, right? Something changed. What happened? That caused the caseworker to get stuck. And so one of us realized, hey, maybe we should just ask the caseworker what happened. And so we reached out to the caseworker, did sort of a quick, not, I wouldn't call it an interview, but just a quick conversation. And we learned that what this caseworker did was that she was able to delegate the form filling task to the AI tool. And instead of sort of sitting awkwardly with her client and waiting for the tool to finish, she actually decided to use that sort of waiting time or processing time to work on sort of a parenting skill module with the client, right? And so I think the point here is that like a story like this and being able to collect qualitative information like this kind of flipped the implication of this, of what we saw on the product log, right? And it wasn't the extended session wasn't really about friction or error, but instead, in some ways, it validated our hypothesis because now we're sort of hearing this very real story about how the tool freed up time for the caseworker to interact directly with clients, and in some ways, sort of this productive multitasking. And I think this also like reinforced a valuable lesson, important lesson for us, which is that, for me especially I'll say as a quantitative person, right? Sometimes like I myself risk over-indexing on metrics, right? And I think this is a good reminder for us, all of us, that even the most detailed metrics can have limits, and sometimes the most compelling, the most telling evidence doesn't come from a dashboard, doesn't come from a chart, but that it comes from simply one of our participants telling a real world story about what it's like to use the tool or to use the intervention and what that subsequent downstream impact is. So here's sort of the take-home message for this section on small samples. Remember that when it comes to designing impact evaluation for AI tools, whether you're working with government partners or academic partners or community partners, you don't necessarily need a large sample to do meaningful impact evals. And echo what Ryan and Laurel have said in previous slides. I think with a thoughtful, intentional, and ahead of time selection of methods, right? You think about shadowing, observations, interviews, usability testing, surveys using validated measures and product metrics. What we've learned is that even a small pilot with 20 participants can generate valuable evidence to help inform decision making and also to help you better understand the impact of your intervention and what to do next. And speaking of next, I will hand the mic to Ryan.
Great segue as always. I'll take a quick moment to pause and say, Jenny, I see your question in Q&A, and it is a very good one. So we'll try to make time for that at the end. And for others, feel free to keep the questions coming in Q&A, and we'll do our best to save some time at the end to go through them. Okay, so for this question, we are going to get a little bit into what you will probably find if you do a Google search for how do I assess accuracy of AI outputs. But this is obviously important in our space because we know if an AI tool is generating bad answers or taking incorrect actions or not taking actions where they should be taken, that can be the difference between a family or an individual actually getting benefits or getting denied or delayed. And it has real impact to these workflows. So, of course, this is a big part of the evaluation picture as well. And in our walkthrough, we're going to anchor on the assistive chatbot here. And so again, this is sort of a typical chatbot interaction, but grounded in policy and plain language information about programs like SNAP, Medicaid, and others. And again, the unique flavors, these direct quote citations that can't be changed by the LLM to support the caseworker in giving high quality information. And pilot-wise, this is piloted with our partners Amplify, who offer a benefits screening tool to community-based organizations in the Los Angeles area. So caseworkers who might have to answer questions about any number of programs. And so what does accuracy look like in this case? We kind of have two very large ways of looking at it. The first is just the accuracy of the tool itself. So independent of what a caseworker does or doesn't do with the information, is the response correct, grounded in the correct citations, and usable at a baseline standard? Is it written at the reading level that we want it to be? Things like that. And then you combine the tool accuracy with the actual context accuracy. So when a caseworker is having a conversation with a client or a family, does the information they're getting actually help them respond to questions they're getting from clients in the real world? So in the real world, how do we think about that? For this project, that meant a lot of conversations with caseworkers, their managers, and clients, individuals, and families themselves to hear what kind of questions they were coming up against. Things like, maybe I'm familiar with Snap, but there's this in-home supportive service program that someone asked me about last week, and I really didn't know how to answer them. So having those as the building blocks for our library of evaluation questions for the chatbot was key. Um, Otherwise, it would just be kind of us on our laptops making up questions that we think are realistic. The other area we combined with are places of known complexity and policy rules. One example is the rules for college students applying for SNAP are fairly complex and cause a lot of questions, and known error patterns. So again, we worked with our partners at Better Government Lab, and they looked at a lot of data about SNAP applications in particular to identify where are the hotspots of errors so that we can make sure the tool is doing a good job of responding to those topics. This tool was available in Spanish primarily, so we worked with bilingual caseworkers to start to evaluate that to make sure there isn't a gap in quality in different languages. And then we know if you're giving someone access to a chat tool, there will often be ambiguous or incomplete prompts. So that could be something like you ask about how to report medical expenses, but you don't specify which program you're talking about. We want to make sure the tool either gives you a summary of all the programs where that might be relevant, or it asks you, hey, did you want to know more about SNAP or Medicaid or a different program for this prompt? And then lastly, all of these situations are important. Benefits can be such a huge difference in someone's life and resources, but also hearing about situations where mistakes might matter the most for sensitive topics. Things like household composition and immigration status was one that we were trying to be especially mindful of for how the tool answers and what kind of sources it was using. So many methods to kind of ground all of our evaluation in what matters to people in the real world. And for a quick small snapshot of what that looked like for the chatbot, we have a screenshot of one of our evaluation tables. And so you can see we have questions, we have them broken down by program, we have topics, and sensitive topic was one of the topics. So we could just see all of those sensitive questions all in one place, and then also break it down by other common areas. And then working with our internal team, our partners, policy experts to try to develop expected responses and the expected citations for what we would want the tool to return. And honestly, sometimes we would find new citations by using the chatbot, and we would feed those back into our evaluation set to improve the quality. And then just a quick note, this is for a chatbot, so it's sort of a straightforward, you send a question, you get a response. There are ways to adapt this to accommodate things like a tool, an agentic form filler going through a page and filling out a form. You might have, for instance, a lot of rows to show all of the actions it's taking on a page to say it missed this drop down to indicate the household size and get that level of specificity for a more agentic tool. but a topic for another demo day. For this tool, we partnered with Better Government Lab to do a deep evaluation on the chatbot specifically, and trying to answer this question, can caseworkers give clients more accurate guidance when they're supported with the chatbot? And there's a link to a case study with a lot more details about the methodology and what this looked like, but I'll just give a quick overview, and we'll put this link in the chat soon. But generally, Better Government Lab worked with us and our partners to recruit 125 caseworkers. They developed a set of realistic public benefit scenarios with that approach I was describing earlier of identifying kind of hotspot error topics in SNAP applications, where those topics caused a lot of issues. And then they developed questions. They had a SNAP policy expert help develop scenarios to go along with the questions and sort of a multiple choice set of answers to be chosen from to add a bit more structure. And then the group was split between a group that had sort of a image or a integrated view of what the chatbot would respond to for that question, and a group that did not, to show if people perform better with the chatbot than without. And they found generally about a 40% accuracy boost overall, and finding the largest gains on the hardest questions, and pretty promising evidence that the tool helps boost the accuracy for the caseworkers using it to support SNAP questions. For a bit more of an illustration of what that looked like and how you might think about your own way of applying this, for these SNAP questions, we had client attributes because things like age or employment status might change the answer for a given question. And then we have the question itself, in this case, a deduction for transportation costs. And then for the group that had the chatbot suggestion in their survey, it would look like this, and it would be kind of a reflection again of what the chatbot would respond with if they had asked this question to it. And so all of this is in service not just of showing, 40% accuracy boost. That's great. But ultimately, we also want to hear things like this that we heard from Jason, where he was actually able to use this tool in his workflow to either prepare ahead of time, dig a little deeper into exact policies and how things operate so he can be more confident in his answers. And for him, that meant either preparing for a client that he knew was coming in who had a particular question, say how to apply for in-home supportive services, or after the fact, it would help him reply more quickly to questions from clients or kind of prepare a resource guide for them before they left the clinic that he worked in, as opposed to having to wait and send them an email later on. So those are the types of outcomes that we want all of this accuracy to build up to. And lastly, to wrap things up, we'll talk about how to apply what we've learned in decision making. So we have a lot of different methods, we have a lot of different signals. How do we combine it all and think about the responsible path forward? So we want to think about how to form our data into a story and then use that story to inform our decision-making process. And our decisions could be a lot of different facets of an AI tool. It could be who the tool is ready for, who it isn't. Maybe it's ready for managers, but not individual staff, or vice versa. What tasks can it support? Is it ready for a simple one-page application form, but not yet ready for a multiple-page application form? What claims about the tool's performance do we think are supported by the evidence we have so far? What safeguards must be in place to either continue giving people access to the tool or expand access to it? And what it will cost to operate. So the cost of an agentic form filler is different than the cost of a chatbot, and that's part of the kind of cost benefit analysis that needs to be done. And then, of course, what still needs monitoring? So what are we still not sure about that we're either going to continue to monitor with our current setup, or change who has access to the tool or how we're measuring it to get more information about? And we know we need to do this because no single data source will tell the entire story. Michael's example earlier was a great example of why qualitative interviews can be a great supplement to product logs and observability. And then, we need different data sources to tell us about effectiveness of the tool, who is using the tool and who isn't. What's the risk? Are we actually seeing off-topic questions or responses? How is burden changing for clients and staff? Cost, as I mentioned before, and then also readiness. So for clients, staff, and an organization, do they seem excited about this tool? Do they seem like you're kind of dragging them along and they don't feel very involved and they're not really engaged in this tool? All different factors that might inform your decision making. So for the chatbot, at a high level, that looked like accuracy. I went through the Better Government accuracy assessment for deep accuracy evaluation on SNAP questions. We were also working with subject matter experts to do team reviews of outputs. And then we also supplemented that with LLM as judge reviews to get broader coverage and to kind of tell a cohesive story rather than relying purely on, asking ChatGPT to evaluate the chatbot's answers to see if they're good or not. We also had different methods to track real world usage, including a 14-week pilot and surveys. So we could see everyone who was and wasn't using the tool. And then we had surveys to try to get a bit more information about why, as well as product logs to, again, show everything that was happening in the tool. And then interviews to dive even deeper. We were creating little visualizations of all the questions someone asked or didn't ask of the chatbot, and using that as a method to get more depth of understanding about why people were using the tool in a certain way. And then lastly, different signals about the context the tool was implemented in. So things like cost, things like noticing organization A was using the tool a lot, organization B was not, kind of building on the product logs. And then lastly, we were running trainings and communications with all of the organizations throughout the pilot. So that was also a source of information about how the tool was doing. And so taking all these elements of the data story, trying to frame a decision to make based on them, the first step is to define the choices, and this will be different depending on context, but generally the choices might be to release a tool broadly, to release a tool to the public that used to be only internally facing, or to release to more organizations to scale, to expand the use cases. So maybe the tool started as a SNAP focused tool, but you think it could be useful for Medicaid. Improve the performance on existing uses, narrow it. So maybe in the tool has tried to address too many use cases and it's not doing a good enough job. So you really want to focus on the core, most important one to make sure it's high enough quality and getting the outcomes you want. Or there's always the option to stop. Either the cost is too high, the risk is too high, or the usage isn't where you want it. It's always an option to stop or scale down as well. And then for each of these choices, the process of defining the evidence threshold. I wish there was a clear-cut rule for this, but I think this is really a conversation every team needs to have about how do they determine what the threshold is for whichever choice they're trying to make. So what result would make each path responsible? And again, to try to illustrate this is a hypothetical decision, but we could imagine ourselves thinking about whether to expand this policy chatbot statewide. And so we would bring all of our evidence together. You can maybe picture sort of a group workshop where you're bringing all of this evidence together and you're trying to come up with a recommendation based on all of your different perspectives and all of the different data you have accessible. And so for the chatbot, we walk through things like accuracy, usage, safety. So seeing like, okay, our guardrails are doing a good job, not responding to off-topic questions, but we're also learning caseworkers aren't deeply reviewing every answer. Does that change our decision about scaling it? Also balancing that with impact. So we're in this scenario, we're seeing they're able to respond to more requests, get more client requests responded to, lower administrative burden, and then putting cost and everything else into that picture. So kind of putting everything out on the table, having some sort of group decision-making process or individual decision-making process, depending on your context, to come up with a recommendation. So maybe in the scenario, we do want to expand it. We're not quite ready to just give it to the whole state. And we have a caveat of we can only expand this if training, escalation pathways for human review, and content updates, we have 20% of a few people's time to be able to support that. Otherwise, we don't think it's responsible to scale this tool. So hopefully that was all useful in terms of bringing everything together and coming to a decision-making moment. And everything we talked about today is all in service of this question of knowing what works for whom and under what conditions. So a few high-level takeaways: adapting approaches to your own project's needs and constraints, and where you can, using tried and true methods like the administrative burden survey to emerging technologies, and trying to make evidence-based decisions about adopting and scaling AI tools rather than just off of the vibes. So we have a lot of ways to follow along with our progress. We have case studies and more on navappc.com/labs. We've already shared the Caseworker Empowerment Toolkit website, and then we have a newsletter as well. And I believe there's already a sneak preview of kind of a methods and toolkit document. It's work in progress, but we are sharing kind of a collection of the methods we've been describing today in a Google Doc that I think one of our teammates can share in the chat. And that'll be it for today. So we'll try to get to a few questions before we drop. And Greg just shared the toolkit. There's a link to it on that page. And great. Okay. This first question for Jenny, I've been looking at it for a while. I think it's a great one for Michael and Laurel. And the question is, are there situations where you are unable to get baseline values from the pre-intervention stage? If so, how do you measure impact then?
That's a great question. So one thing that I want to point out is that randomization can work without a baseline survey, right? So if you're in a situation where for some reason you're able to do randomization, but you do a baseline, then that is something that is possible. I think another
I think we lost you there for a bit, Laurel.
I'm sorry, can someone let me know what the last thing I said was that anyone could hear?
I think generally we heard randomization is possible even without the pre-intervention stuff.
Great, yeah. You can also look at qualitative research to understand people's perceptions of how things have changed. One caution with AI tools is that we know that there are many situations in which people's perceptions of their experience with AI are different from the reality. And so a lot of the stuff that we've been talking about is really about caseworker well-being. That's great. Caseworker well-being is a really important goal for us. But I want to distinguish that caseworker well-being from the idea of recommendation quality. Those two things are really different. They require different kinds of measurement. And so if you want to understand how people are perceiving their work versus how things are changing in the amount of work they're able to do. Another thing to think about with challenges with getting pre-intervention data is to broaden your sense of what data might be, right? So if you can't field a survey before an intervention, okay, cool. Can you get access to administrative records? Can you interview supervisors or individuals about how things typically go, right? So that you can have a sense of approximately what they're looking at, what people are experiencing, even if you don't actually get quantitative data.
Great. And for how do you think about user-facing AI versus AI built into the backend? Are there different criteria or standards for when it's user-facing versus part of the logic powering the backend versus for internal efficiency within the dev team? Yeah, every scenario will have kind of different outcomes that you're looking at and different thresholds for comfort releasing something. So for instance, for all of our tools, they are caseworker facing, so not fully public facing. Like anyone as a member of the public can't go to a URL and use the chatbot. So that generally will raise our comfort a little bit because we have the human in the loop to review it. But a lot of the times we'll be comparing to current performance. So how well do caseworkers do on answering these questions or doing this task before the tool? And if the tool is improving on that, that's generally a sign that the tool is making progress. But obviously there are other factors, especially for the public. I think there's an expectation that an AI would do much better than current baseline performance. Because when it does do things wrong, the risk of bad PR or things like that are very high. And, we could keep breaking it down for dev teams. It might be sort of code quality. Each scenario will have its own outcomes that matter. And the level of comfort for when something can be released really does need to be a conversation. There isn't one rule. And even if it's better than the current state, that's not automatically a signal to release something. And then quickly, before I see someone raise their hand, approaches for building rapport. A lot of that was trying to involve people before the tool was fully shaped to try to make sure that it was actually something people found useful, that it was acceptable to them, and for the people they work with in terms of what data it was collecting and how it was using things, as well as the actual task it was doing. So a lot of the report process was building it together with people and then emphasizing that and using concrete examples of how we see it supporting workflows to introduce it to people who maybe weren't involved at day one. And um, sorry, I think someone had their hand up, but we're also at time, so I'm conscious of that. If you had a question that you want to follow up on, feel free to reach out to us at labs@navapvc.com. And generally, thank you for joining our session. We really appreciate it. And our toolkit will continue to be developed. We'll continue to share a lot of resources. And yeah, excited to keep this conversation going with all of you in this community. So thanks for joining.